The following show is for entertainment purposes only. The opinions listed do not constitute medical advice. For health guidance, see your medical provider. Listen at your own risk. It's time to get your man on.
Hello, hello, hello. How's everybody doing? What's going on? You heard it. This is Get Your Man On, a show for men, those who like men, and those who want men to level up. I investigate men's health, sex, and the newest treatments with medical professionals, celebrities, and thought leaders. It's a show for anyone with a brain or a body. Coming up in the next 10 minutes, Shockwave therapy. Does it work? It's all the rage. Also in this episode, testosterone, erectile dysfunction, and we'll be checking messages on our anonymous voicemail line. Let's talk about acoustic wave therapy. It was about 7 years ago, and I get a call. It's a 702 number. Those of you that know, that's Las Vegas. I'm like, I don't know that number. I pick up the phone, and Evan, I was like, I know this voice. Brought back memories from back when I first started in men's sexual health space, and it was a guy on the line who they used to call him the Viagra King, physician in Las Vegas, who right when Viagra came out was prescribing the heck out of it. I mean, it was like early 90s heyday of Viagra, just come on the market. Everyone wanted it. This guy had it in Vegas. People were flying in from Asia, I'm like all over the world to find this guy, and then going back to their countries with, sleeves of Viagra. So this guy, he's actually a pediatrician, which makes it even more funny. But this guy was doing ED before most people were doing ED, before it was cool. So I had gotten to know him professionally because, being in this space, you get to know some of the people that have been around for a while and have tried the new things and tried the old things, the ones who you figure out that stuff from. And he said, Evan, I got the next great thing in ED. I was like, okay. Automatically wanted to grab my wallet. Like, what's going on? What's happening here? He said, there's this new procedure called acoustic wave therapy. I was like, okay. He's like, it's this device. It's non-invasive, and it helps guys with erectile dysfunction. I was like, okay, tell me more. He was like, well, they've been using it in Europe for years, and he proceeded to tell me all about this stuff. And I was kind of like, man, okay. Well, I have some tried and true things that, we're using in the clinics. Like, I was a little skeptical at first. So I got to looking at it, and yeah, there's some great European studies on it. So acoustic wave therapy is relatively new to the States, been around in Europe. It's actually been around for treatment of like kidney stones and orthopedic conditions for a long time. And so it's non-invasive, and actually you're basically running sound waves through the body part that you're trying to heal. And so in this case, obviously, we're talking about healing the penis, right? Most erectile dysfunction comes from blood flow issues. When there's decreased blood flow, it's more difficult to get an erection, right? So you've solved the blood flow issue, you solve the erection problem. And so the theory here is that this device will actually break down the cells of the penis and cause them to regrow back stronger. It's essentially 15 to 20 minutes. You got to do it in person, right? And you have like this wand, right? And you basically run it up and down the penis for 15 or 20 minutes, and you're just shooting sound waves into the penis. And so you do this. The studies are based on 6 or 12 different treatment types. The results can be dramatic. We've been doing this thing for years, and I've seen incredible results in our patients, like just remarkable stuff. Most people say about 50 to 80% will see a positive response. Now you got to be careful with that, because the 50 to 80%, is like any improvement at all. But on for most people, according to the studies that I've seen, you're going to get an increase of about 25%. There's something called the IIEF score, which is the International Index of Erectile Function. And it's a questionnaire that basically it's 25 questions. And you answer these questions, 15 questions, and you answer these questions, and it kind of shows where your erectile function is at. And so on this scale, ESWT, acoustic wave therapy, is shown to improve erectile function by about 25% on average. Now, I've seen guys come in, they absolutely changes their life. I mean, they're set for, they're like, I can get an erection again. It's great. This is incredible. And then some guys are like, yeah, it worked a little bit, worked best. So there's not a ton of studies on severe ED or patients with like diabetes and things like that. But for like mild to moderate ED, we've had great success with it. It's been very successful. And so we use it frequently, and I just don't want you guys to go out there and find the stuff online and all that. I mean, the online stuff is ridiculous. I can't tell you, not just on these acoustic wave devices, but on testosterone. There's been like a wave of online testosterone people, and then we get their screw ups. Patients come in and they're like, I don't know what's going on, but I feel terrible. I started this online therapy, and it's like, man, like that's a controlled substance. You're supposed to have a face-to-face visit with a provider, and they're doing this online thing using COVID rules, right? And we just see so many patients get screwed up, and I just hate it. Same thing like the pills. It's like, oh, there's all these cheap pills flooding the market, and it's like, and it's so cheap, and it's like, oh, they get like, very, very small milligrams compared to what actually works. And so I want to say, it's really important to go talk to someone about it. I know it's embarrassing. I know it's one of those things that's tough to talk about, but it's just not that big a deal. The people in my clinics, people in clinics that I know of, it's like treating an elbow. It's not a big deal. You should 100% get treated. Take care of ED. It can often lead to a lot of other beneficial things when you treat your ED, when you get it taken care of. There's many treatments. ESWAT, acoustic wave therapy. Check it out. You should learn about it. See if it's right for you. Go in and see a provider. There's lots of options. It's great for guys who maybe are unable to take the other medications for treating ED. It's great for guys who maybe are more holistic, don't want to take medications, or you've experienced side effects from the pharmaceuticals. You should investigate to see if that's the right way, because the side effects with acoustic wave therapy are minimal. Really, you might have some bruising. Frankly, I've never seen that, but I'm just saying what's like on the page here. Like, there may be some pain afterwards, but the benefits have outweighed anything that I've seen out there that's been negative. So check it out. Coming up next, we are going to do a deep dive into more erectile dysfunction medication. I want to talk about not just ESWT. We're going to talk about a whole bunch of this stuff, and we're going to hear from our anonymous voicemail box. If you have a question for us or need to get something off your chest and leave a secret confession for the world to hear, go to getyourmanon.com.